We have a lot of gram-negative resistance, like I had mentioned. So we're trying to find out if this new antibiotic is more efficacious than what we're already using for these really resistant gram-negative organisms. So a lot of the literature out there is small studies, and it's looking at combinations of antibiotics. And we don't have really good outcomes with those, so poor mortality rates, poor clinical success. So we're hoping this antibiotic is going to be better than those. So I was looking to see what the outcomes are. This was a retrospective study that I completed. It was a multi-center study, so we had a lot of hospitals involved. And we were just trying to find out, is this antibiotic any good? Should we be using it by itself in these infections? One of the outcomes wasn't to evaluate if it alone versus combination therapy was better, but we did have patients who received this antibiotic with other antibiotics or that received it alone. So we're just trying to see how it does in these type of severe infections. Basically, since this was retrospective, what we did is looked at any patient who had received this antibiotic for a carbapenem-resistant gram-negative infection and looked at their outcomes. So in-hospital mortality, microbiologic success, and clinical success. Since it was retrospective, there was no control over, what the patient was receiving, what dose they were receiving, things like that. So a lot of patients had been receiving concomitant antibiotics along with ceftazidime-avibactam, which could include aminoglycosides, polymyxin, colistin, carbapenems, so a variety of things. And we didn't necessarily compare the two, monotherapy versus combination therapy. We weren't really set up to do that. But in all of the previous literature for carbapenem-resistant infections, patients received monotherapy or combination therapy with any variety of things because we don't know what the best thing is at this point.